Understanding the YouScript personalized prescribing system. Thank you for taking the first step to learn more about your results. I'm Chantel, a personalized prescribing specialist here at Genelex, and I'll cover the basics of pharmacogenetics. At this point, you should have received your patient wallet card, which looks something like this. Now you probably have some questions about this information. I plan on addressing these questions during this presentation and helping you to better understand your YouScript personalized prescribing results. Don't forget to start a conversation with all of your healthcare providers regarding the specifics of your care and medication management. Keep in mind that our advice does not take the place of consulting with your healthcare provider. Finally, it is important to be an advocate for your health. I recommend that you complete the form titled Release of Results to Additional Healthcare Providers that was sent along with your patient wallet card. By returning this completed form to Genelex, we will share your results with all of your healthcare providers. Now let's get started. First of all, what is YouScript? At a recent appointment with your healthcare provider, a cheek swab or blood collection was taken. This sample was sent to Genelex for YouScript testing. By analyzing your DNA, Genelex was able to evaluate how well your body processes a variety of pharmaceutical products, ranging from dietary supplements and those available over the counter to prescription medications. With this pharmacogenetic information, your healthcare providers are empowered to personalize your medication regimen, thereby improving your health. I've introduced a subject many patients are less familiar with, pharmacogenetics. Let's take a moment to define it. Pharmacogenetics is an emerging field of genetic testing that describes how individual people respond to drugs based on their unique genetics. When you take a medication, enzymes in your body break down that medication so it can be absorbed into your system. Your genes determine how well these enzymes break down medications you've taken, and whether the prescribed medication and dose will work for you. This is a complicated topic. Let me explain pharmacogenetics at a more basic level with the sink and drain analogy. Imagine your body as a sink basin. The water flowing from the faucet into the sink basin reflects the amount of medication you are taking. The size of the sink drain mirrors your body's ability to process medications. Normally, a sink drain is built such that it allows for a balance to be achieved between the amount of water building up in the sink basin and the amount of water flowing through the sink drain. This is the same balance any medical provider seeks when they prescribe a medication to a patient. The goal is to reach a slight buildup of medication in your system to achieve a level that allows the medication to have its desired effect, and the remaining medication to be broken down and discarded. Therefore, patients identified as normal metabolizers for a given drug processing pathway can generally break down standard doses of a drug. However, if a patient possesses a variation in a gene that is responsible for processing a medication that they are taking, this can be a more challenging balance to achieve. Genelex identifies a variety of genetic differences that may help your healthcare provider choose the right medication for you, and to avoid other medications that you may be more likely to experience side effects from. The first variation is an intermediate metabolizer. From the figure on the screen, you can see that an intermediate metabolizer has a slightly narrower drain size. Therefore, water does not leave the sink basin as quickly as in the normal metabolizer example. For the patient, this leads to a slightly greater buildup of medication than expected. Therefore, a lower dosage of medication may be required to prevent a buildup of medication in an intermediate metabolizer patient. A patient reported as a poor metabolizer expresses a similar variation to a higher degree. As the figure suggests, the sink drain in this example is narrower still than the intermediate metabolizer. Think of a partially clogged sink drain. Water no longer flows out freely, causing a buildup of water in the basin. If the faucet is left on, the water will continue to rise and possibly overflow. Even at a low dosage of medication, Poor metabolizer patients may experience side effects because they are slow to break down and clear the medication from their systems. Ultra-rapid metabolizer patients are at the opposite end of the spectrum. In this scenario, the sink drain is very wide, so wide that the water flows out of the sink basin almost instantly, with no water accumulating in the basin. Patients breaking down medications this quickly may require a higher dose in order for the drug to work properly. Now that you have a better understanding, let's break down how this information is presented on your patient wallet card. Below your name and lab number, list the scientific names of the gene variants for which you were tested. To the right of the gene name, list the result, which in most cases identifies your individual metabolizer type, such as normal, intermediate, poor, or ultra-rapid. In other cases, it will indicate sensitivities, activity level, or probability for positive or negative responses. On the right is a series of numbers and asterisks, noting the specific version of the gene that the Genelex laboratory has identified. Each of these corresponds to an activity level for the gene reported. For instance, the CYP2D6 gene, both *1 and *2A variants are normally active versions of the gene. This information is essentially the raw data that is translated into metabolizer type names mentioned above, such as normal, intermediate, and etc. For the patient and the healthcare provider alike, it is best to focus on the metabolizer type. Genelex includes this specific information just in case another lab was to encounter your card. In some cases, additional testing was ordered by your healthcare provider. To better understand these additional results, feel free to call the customer support department at 877-431-4362. Notice that the CYP3A5 naming standards work differently. Patients are reported as non-expressors, intermediate expressors, or expressors of CYP3A5. For this particular test, the majority of the population does not express the gene and does not normally use this pathway to metabolize medications. These patients are reported as non-expressors. A CYP3A5 intermediate expressor partially expresses this gene, while a CYP3A5 expressor fully expresses this gene. What does this mean for your healthcare? By consulting the information on your patient wallet card, in conjunction with their clinical experience and familiarity with your medical history, your healthcare providers will be able to personalize your medication regimen. Perhaps the normal dosage you are taking works well. If not, your healthcare provider may consider decreasing or increasing the dosage. In some cases, an alternative medication may be the best option. Do you have more questions? Feel free to call the customer support department at the following number, 877-431-4362. If your healthcare providers have questions, encourage them to give us a call as well. They can speak with a customer support department member or be connected with a Genelex pharmacist for a consultation about your care. This concludes our presentation. Thank you for watching.